PICAC stands for Partners in Culturally Appropriate Care and is a national funded program by the Department of Health since 1997. We support aged care providers to be more inclusive and deliver culturally appropriate care for older people and their carers from culturally and linguistically diverse backgrounds. So they are all PICAC members in states and territories. If you need any support in this space, please contact your local representative. You can find their details on our website, which is www.picacalliance.org.au. Today's webinar is called Accessing Culturally Appropriate Resources for Your Consumers. As you might know, Department of Health mentioned in the diversity framework that older people have easily accessible information about the aged care system and services that they understand and find the information helpful to exercise and control over the care they receive. Many resources are available for cold consumers to assist them accessing the aged care services. And today, PICAC Alliance speakers from across the country will provide you with how to access these resources. And I would like to introduce our first speaker, Lisa Tribozio, the manager for the Centre for Cultural Diversity in Aging, PICAC Victoria. Over to you, Lisa.
Thank you so much, Selene, for that introduction. And it's a great pleasure to be here today to give you a bit of an overview of the multilingual resources available from a Victorian perspective. Just a bit of an overview of the 10 birthplaces of non-English speaking background people over 65 in Victoria. Here are the top 10 countries of birth available from the 2016 census. So we're going to give you a copy of this presentation for you to have a look at after the webinar. So just bit of an overview there of the languages. Of course, the Centre for Cultural Diversity in Aging's website is a nationally funded website by the Department of Health, and it is a hub of information of multilingual resources relating to aged care. If you go into the Service Provider section tab under Multilingual Health and Aged Care Information, we are constantly updating that page with a range of topics relating to aged care. We also have our own multilingual resources that we've developed at the Centre for Cultural Diversity in Aging. We have communication cards and aged care signage in 57 languages, consumer feedback forms in 12 languages, where all you need to do is insert your logo into the feedback form and print them out yourself. It's a standard feedback form. And we've also uploaded the Victorian Government's interpreter cards on our website. The multilingual communication cards are to help reduce language barriers for older people living in residential care or even in home care services or other aged care services and hospital settings. They cover topics like personal care, feelings and pain, food, drink and meals, religion and spirituality, sleep and medication or health-related topics. It's a very, very popular resource. They are all downloadable on our website. And it can be used to help your consumers. If you are acquiring new languages other than the 57, let us know because we do have funding for new languages. The interpreter cards are also available on our website, but they are a resource from the Victorian Government. And it's a resource for consumers to put in their wallets or their bags and for them to know that they have a right to an interpreter in any service system that they access. So they simply show the card to the service and say, I need an interpreter. We also have our immigrant experience videos, which showcase the stories of 4 older people from culturally and linguistically diverse backgrounds available on our YouTube channel. And they're a really good resource to look at the way in which older people can showcase their stories and what's important for them in their lives. Other resources that are available in Victoria include obviously the Ethnic Communities Council of Victoria Golden Years newsletter, publication, which is an amazing publication with updated information on aged care related information in Victoria. The Access and Support Program, which are aged care navigators that speak different languages, can help older people navigate the service system. And there's Migrant Resource Centres, Victorian Multicultural Commission. The Centre for Cultural Ethnicity and Health have health translations. And of course, there's also our diversity advisors and of course the Centre for Cultural Diversity and Ageing's LinkedIn page and our social media for always good practice examples, weekly good practice examples. So I encourage you to look at our LinkedIn page and subscribe to our newsletter. We also encourage multilingual media platforms. So there's the National Ethnic and Multicultural Broadcasters Council, which have their ethnic broadcaster publication, ethnic radio and newspapers such as Il Globo, which is the Italian one, which covers over 110,000 people readership. And then we also encourage people to look at international satellite TV stations. So, for example, with a situation we came across recently with the Bosnian community, we found that there was a Bosnian channel, which is about $25 a month. And all they need is unlimited Wi-Fi and Chromecast, which you can get from JB Hi-Fi or any other IT outlet, and you can put it in an HTML cable on the TV and they can watch international media channels. Flip Connect also has different packages in different languages and the languages are listed below. We also have our multilingual older persons COVID-19 support line, which has just been launched in February, and it is a pilot program until July. And it's available in 6 languages, and that gives older people and their carers and advocates updates on COVID-19, dementia support and aged care, anything relating to aged care. So that's available on our PICAC Alliance website. And they're the 6 numbers there that they can call in language. For further information about Victoria, you can contact this information. So thank you very much. And over to Selene.
Now we are moving to the Multicultural Learning and Development Manager from the Multicultural Aged Care PICAC South Australia, Agnieszka Hudecka.
I'm so happy to be here with you, and I'm so happy to almost see over 100 people watching us today. I would like to start by the census data. You can see on the screen the top 10 birthplaces in South Australia. So you can see where people were born. Just a bit of a note here. Please do follow with some questions, because if someone was born in Germany, for example, doesn't necessarily mean that they will be speaking German. They might have been on their migration journey already and just born there. Thank you, Lisa. I would like to start with talking to you about our amazing resource, and it is a national resource. It's called the Multicultural Aged Care Library, funded by the PICAC program from the very, very beginning. It is the biggest collection in Australia on cold aging and on cultural diversity. As you can see, the shelves are packed with resources, and not only we welcome people to come visit us and borrow as many resources as they find useful and helpful to enhance their work, but also we provide a metro-wide mobile library service. So you can give us a call and you can arrange a date with us, and we will come with targeted resources to you. Also, if you are not lucky enough to live in South Australia, you can browse the nationally accessible catalogue, and you can as well order some resources, and they are going to be sent to you, and you can use them as well. So feel free to use our amazing resources. As you can see on the screen again, that's a multicultural calendar. So it is not only a nice element to have on your wall in the office or in a community hall, but also it hopefully can provide lots of inspiration to inform your events, culturally specific to various cultural backgrounds. It is available in hard copy, as you can see, but also you can download it from the MAC website. You can print it yourself, or you can go and print it externally to have a bigger format if you want to. Thank you, Lisa. Another resource, again, available in hard copy and also available online for your reference is probably more specific to South Australia, because it gives you information about South Australian aged care services owned and operated by CALD communities, but also groups who are there providing services to older people, organizing sessions, but also many of them involved in community scheme visitors that I will come back to on one of the further slides. And you may also browse it for culturally specific information, or if you had any specific questions. You can use it yourself, or you can contact us as PICAC South Australia, as Multicultural Aged Care, and we are more than happy to share updated information with you. And coming to that quite naturally, thank you, Lisa, is power of networking. It is a very important part of our work in South Australia. We try to facilitate as many as possible opportunities for collaboration, for making partnerships, for working together on shared projects, but also to come together and share our experience and facilitate peer-to-peer learning. And it worked beautifully well and was amazingly enhanced during COVID-19 so far, when so many organizations stepped up like that, and the power of networking was amazing part of that process. So please make sure that you have subscribed to our list and you are up to date with information, because what we share via emails are information not only about sessions organized and facilitated by PICAC South Australia, but also by others in the community and aged care sector. Finally, the information about Community Visitors Scheme. It is an Australian government initiative, and even if here on the slide you can see information relevant to South Australia, it is a national resource. So it is very, very important and useful to go and browse to get information about your local community and about the locally operating organizations, because they may offer people, volunteers, who will be more than happy to come and visit your older people, your clients, your consumers, your patients, to speak the same language, to share the same cultural background. And we all know the amazing value of face-to-face meetings whenever possible. If you wanted to contact us, you will find all information on the screen, and the presentation is going to be available later on as the reference, and also contact details regarding our library. And I hope to see you here soon.
Thank you for the information. So now the next person from the Multicultural Communities Council of Illawarra, PICAC New South Wales and ACT Strategic Partnership Manager, Jim Bulchens.
Thank you, Selene, and hello, everyone. My name is Jim Bulchens, as Selene mentioned, and as the manager of PICAC New South Wales and the ACT program, I'm delighted to be here to share with you the resources available to our CALD community. I'd firstly like to acknowledge the great work done by the New South Wales and ACT team in developing and disseminating information and the resources that are available to our communities. Let me begin by sharing with you the top 10 birthplaces of our CALD consumers in New South Wales. These are statistics based in 2016, and they are from Germany, the Netherlands, Italy, Malta, South Africa, China, Greece, India, Egypt, and the Philippines. I'd like to share with you several other resources, but before we do that, I'd like to mention the importance of considering the individual needs of our consumers from CALD backgrounds in offering them culturally appropriate care. It's a skill like any other skill which needs time and training to make it part of our normal thinking process. Education in cultural diversity is an important factor for aged care teams in understanding the care needs of individuals from different cultural backgrounds. And of course, there are many resources and cultural competency training sessions that can support you to understand individuals from CALD backgrounds and their unique needs and how to communicate communicate with them in an appropriate manner. And in fact, New South Wales and the ACT, together with MCCI, we've delivered cultural training for over 5,000 participants in New South Wales and the ACT, with about a 98% of them rating the training as very good or excellent. We can tailor training specifically to the needs of your organization based on the outcomes you're looking for, and training can be delivered in person or online. Some examples of the topics we cover are culturally inclusive service delivery, culture, health and well-being, working with new and emerging communities, working effectively with interpreters, working in culturally diverse teams, culture and dementia, culture and palliative care. We cover the whole of the ACT and New South Wales, and in New South Wales we cover the far west up to Broken Hill, the mid-north coast up to Port Macquarie, and down south to Eden. If you'd like to make a booking, please visit us on our website, www.mcci.org.au. I'd just like to share with you a case study now of that illustrates the difficulties faced by coal communities in navigating the aged care systems.
I want to come to group the pensioners.
That's okay, but first we need to go to My Aged Care and a referral needs to be made so you can access the services.
I don't know how to do that.
I can give you a phone number and your son can call.
My son lives in Queensland and my daughter are very busy. Can I please go to the group?
Things have changed and the government is putting new processes in place to make things easier.
My friend come to the group and she said, come and join.
We need to send a referral to My Aged Care, then we'll contact you on the phone and organise a time and date to visit you. They will come with an interpreter and they need to do an assessment. They will decide if you're eligible for our services. You cannot attend the group until this happens. I need some information from you.
All right, yes, no problem.
Can you please give me your Medicare card number?
I don't have Medicare because I go to the doctor.
I'm sorry, Mara, but I can't send the referral without it.
Can I join me group today? I bring card next week.
I'm sorry, but we can't do this without the Medicare card number. If you come back tomorrow, we can do this.
Oh, no. I have to come again.
I'm afraid you will have to do that.
What we're trying to express here is the difficulties faced by a number of coal consumers in expressing their needs and their desires, and to make sure that they are understood by the assessors, etc., who are here to support them. Of course, there's a range of resources available, but connecting with families and friends and other parties is important so that they can convey some of these issues that the consumer may find difficult expressing. And it's important to make sure that we clarify questions clearly, we avoid jargon and slang, and that we provide as much information as is possible to make the journey satisfactory for the consumer. And I'd just like to move on to the other resources we have available. We've got the Bridging Cultures book, which is an excellent book and is intended to enhance the reader's understanding of the cultural diversity of many people, either seeking aged care services or currently receiving services from providers throughout Australia. It includes demographic information on each cultural group and information to assist professionals who are required to undertake a home visit to people of diverse cultures. It also lists key events and dates, some case studies, and interesting cultural facts. The case studies will assist aged care staff and students to understand some of the complex issues that may arise when engaging with older people from diverse backgrounds. Some of the case studies are intended to highlight the challenges that can confront the service provider when dealing with sensitive end-of-life care and dementia use issues. Here we've got multicultural seniors information guides that were developed to assist multicultural communities access government-funded services. This resource guides the consumer journey on My Aged Care and describes how to find out what one needs, whether it's social, home support, home care packages, or residential care. It also describes how to access transport, Meals on Wheels, and a range of services, including mental health and the Community Visitors Scheme. The guide also supports the aged care workforce and students to understand what existing services are available. This next resource, called the 10 Questions to Ask leaflet, is a series of leaflets written by nurses, doctors, and experts with experience in aged care. Each leaflet focuses on an individual aspect of care to increase consumer knowledge and make the journey into residential care easier. These leaflets are available in Polish, Arabic, Mandarin, Turkish, Hindi, and English. And you can check the leaflets out on www.10questions.org.au, which was developed in partnership with the New South Wales Nurses and Midwives Association. The Mental Health Support for Seniors Magnet resource. This is a useful resource for men and women, which contains information and contact numbers on accessing mental health support services. And the next one is on our right-hand side is the My Aged Care Magnets. And these are an infographic which shows the simple steps required to access My Aged Care, which is available in a range of languages, including Vietnamese, Turkish, Hindi, Nepalese, Polish, Mandarin, and English. And we are currently developing the same resource in Arabic and several other languages. We also have links to many of the other resources available to all seniors and others. Most of them are available on the MCCI PICAC New South Wales ACT website. And if you have difficulty accessing them or require hard copies of information, please don't hesitate to contact PICAC New South Wales ACT. There's a raft of information here, a range of YouTube videos, etc., that can take the person seeking support through a range of resources that are currently available and developing for the benefit of the community. Thank you for your attention to this. And if you have any more questions, please get on our website, which is the PICAC website. And the details are here. Thank you very much for your time.
Thank you, Jim. Thank you very much. So maybe for the website, so we can just add mcci.org.au website, and the people can reach these resources also from the PICAC Alliance website too. So now I would like to welcome you to Sylvia Borges, the team leader of PICAC Queensland. The program is delivered by the Diversity Care.
Thanks, Helen. Good afternoon, everyone, and thanks for joining us today. So here are the top 10 country of birth for seniors in Queensland. As Lisa mentioned, that slide's going to be available for you later. So I'm just going to jump in and talk about the resources we have. So the PICAC team in Queensland is here to support aged care providers with cultural resources that are relevant to their multicultural clients. So that includes relevant translated information, resources for lifestyle coordinators and diversional therapists, such as life story templates, conversation starters that are appropriate to people from different cultural backgrounds. We can also help you locate cultural profiles and templates for cultural presentations. We're also available to help service providers with individual cases and to give some advice on possible strategies you may use with clients and residents, and including linking them with community members. So I'm just going to talk today about a couple of cases where we had the opportunity to work collaboratively with services here. So the first one is about Amina. So Amina is an Ethiopian lady who moved into residential care after it was no longer possible for her family to look after her at home. Unsurprisingly, she struggled to adjust to life in the facility, and she did not engage very much with either staff or other residents. So we were contacted by the staff at the facility, who are keen to find ways to make her life easier and gain her trust. So after speaking to the facility people, we connected with the Ethiopian community. And they mentioned to us they believed was organising a traditional coffee ceremony could be a good way to break the ice for Amina and get her engaged in a meaningful activity. So we did that. We organised a coffee ceremony and had a bit of talks about like what the meaning of it and talked about the history of the country. It was quite a positive day and a bit of a turning point for that particular resident in terms of her being a bit more trustful of the staff. We also found out after that day that Amina had strong ties with Italy and spoke fluent Italian, which is quite normal for Ethiopians. And she also started communicating with 2 Italian residents in Italian. And after that, the staff at the facility followed up with organising an Italian cultural presentation based on one of the templates we gave them. And so another case study, another that we were able to help was Mohammed. Mohammed is a Persian gentleman living in a residential care facility. He has early stage dementia and is a very isolated person, has no friends and no family visiting him. In fact, he has very little recollection of his family. And he's also starting to forget English and reverting back to Farsi. So the staff again at this facility contact us to seek advice on some possible strategies for him. So after a little bit of research, we realized that Nowruz, the Persian New Year, was coming up, was approaching. So we organized for Mohammed a haftasing table. And for those who don't know, so the haftasing is a table with some symbols on top of it, things like an apple, and coins and sprouts. Each of those symbols has a meaning. So it's a very powerful visual tool for him to connect with. After that, the staff organised for him to have Persian dinner for the night of Nowruz. And they also committed to occasionally order some takeaway dinner for him from a nearby restaurant. They're very lucky to find one. Other residents were curious about his cultural backgrounds, and the diversional therapists from there organised other little talks and other events for him. We also connected him with the local community visitor scheme to provide him with a Farsi-speaking visitor that could keep him a bit of company and make him speaking his language. I would like to point out some useful websites where you can get resources that are specific to Queensland. And yes, last but not least, here's our contact details. So you can contact us if there's anything you think we can help you with. I'd love to hear from you. Thank you.
That's great. Thank you so much, Sylvia. I think the real case study is always more powerful to give the actual message. Thank you. So now I would like to call the PICAC Northern Territory Program Manager, Cecilia Chiolero. The program is delivered by Kota Northern Territory.
As Helen said, in the Northern Territory, the PICAC program is managed by Council on the Aging, and we've been advocating for seniors in the Northern Territory for over 50 years now. In the first slide, we'll see how the population of seniors from cold background is composed. We see that Greece and Germany and Italy are still the main groups, but there are other groups that are raising the numbers of seniors in the NT, particularly the Philippines and India, Malaysia, and Indonesia from cold background. Regarding information, we are aware that nowadays the quantity of information available is huge, and we can get it from many sources, from websites, newsletters, newspapers. So being able to find the right resources can be very time consuming. And even if the information is more accessible or seems so, there are other issues to consider, in particular the reliability. So we must make sure that the information we are accessing is coming from a trusted source. If it's easily available for the people who need it, and if it's the most updated version of the information, so its relevance with our needs in particular. With these concerns in mind, Kota has designed his website page relating to information, making sure that they are easily accessible, and they are organized in topics in alphabetical orders. People with vision impairment can increase or reduce the font really easily, and every page can also be read, so people can also listen to the description of the page. The multicultural information for the Northern Territory are collected in the multicultural resources area of our website, and they link immediately the consumer with pages and websites that can be useful and can provide them with the information that they need. All the links are active, and they are checked twice a year, usually. These information available in the multicultural resource page of our website are also collected in a publication. It's a booklet that is downloadable from the website in PDF format, or that can be, and that it's a booklet that we print and we deliver in print format upon request or twice a year to stakeholders who need it. It contains links to local websites for information and to national resources, depending on the relevance of the information that you need. As I said, this book is updated twice a year, and we make sure that also the screenshots and the path in the PDF and on the website are checked, so to make sure that they link immediately the consumer, your staff, with the resources that they need. We've realized that these websites are updated more often than someone would think, so we often need to change screenshot or pages links. The services that we can provide consumers and staff workers with is, we provide information packs when we ask for by staff workers or service providers. We connect service providers with community groups. It happens sometimes that we were asked to provide for the names of volunteers or seniors from the community who could go and visit some residents that were lonely because their close family member were interstate. We provide training and information to service providers, but also to communities. We organize a workshop on specific topics, and we make sure we can always provide English documentation, but also translated documentation in their specific language. And we promote aged care rights, of course. And finally, we collect migration stories. We have a collaboration ongoing with the Charles Darwin University. Their students in multimedia communication link with us, and when we are aware of the seniors who would like to tell their stories, we create a script, we plan the video, and we plan the subtitles, the translation, because sometimes seniors speak a mix of English and their own language. So we always provide subtitles. And the stories, once collected, are published on YouTube, on Vimeo, and on our website. So far, we've collected 5 stories, and community groups and service providers are aware that we can create more stories if they speak with someone who would be interested in the project. If you need more information about multicultural resources, training, or social support group for communities in particular. In this slide, you can find my contact details. Reach out to me, and I'm available for questions if you have any. Thank you, Selene.
Thank you, Cecilia. So don't forget to check out the migration stories and then tools guide on the PICAC NT website. So now the next person joining us from another beautiful part of the country, which is Tasmania. So Migrant Resource Centre, the manager of the PICAC Tasmania, Ruth Osborne. So we are with you, Ruth.
Thank you, Selene. Hello, everyone. Yes, I'm from Tasmania, or Lutruwita. We're actually the least culturally diverse of all states and territories in Australia, but that is rapidly changing. And we're also the oldest of all states. 1 in 5 Tasmanians is actually aged 65 years or over. So we've got a very small population, but that means even a small level of immigration has a significant impact on our cultural diversity and our population profile. The majority of ageing individuals in Tasmania are currently from these European countries. It's interesting to compare with the top 10s of the other states and territories. There are quite a lot of the same countries showing up, which I found really interesting. So up and coming, like at the bottom of our, China, India, Malaysia, and also Philippines, those Asian countries are definitely the new ageing population that we'll need to be providing for in Tasmania as the older post-war European migrants are on the way out. So as Cecilia said, in the Northern Territory, there is so much information that is available out there in the World Wide Web now. The tricky thing is knowing where to find it. And my job's pretty easy because I mostly direct people to the wonderful resources that are provided by the other PICAC colleagues on the mainland. So culturaldiversity.com.au and picacalliance.org are 2 fabulous websites that I spend a lot of time directing people to. But there is this one resource I wanted to highlight, which is called Living Well at Home. It was developed by COTA Tasmania last year in response to the COVID crisis. And it's got a nice simple checklist and some tips to help support wellbeing of older people. And it was developed in English, of course, and I liked it so much that I thought I would support the translation of it into these 4 key languages, which are the most commonly spoken languages in Tasmania amongst older people who can't speak English very well. So that's simplified Chinese, Nepalese, Greek and Italian. So those resources are all available for download from the COTA Tas website. I work at Migrant Resource Centre Tasmania. We've got an office based in Hobart where I am and also one in Launceston. And we've got a range of programs including the Aged and Community Services. And we have the Aged Care Navigator program, which provides support for older people from cold backgrounds to understand and register with My Aged Care. And also the PICAC program, of course. We've got a youth program and the Phoenix Centre, which provides support for migrants from a torture and trauma background. And one of the great resources we have is the SoundCloud channel, and that includes short snippets of audio recorded in many languages, often by the volunteers. MRC Tas have got a great volunteer program with multicultural people, and they cover a variety of topics. So the state government have got a multicultural access point website, and that provides referrals and information for new Tasmanians on a range of different categories. And you can see they've included the multilingual older persons COVID support line up there in their news. So a gold star for them. And the other couple of other key organisations to highlight here are MCOT, which is the Multicultural Councils of Tasmania. They support people with diverse backgrounds to contribute and participate in Tasmanian society. There is another migrant resource centre as well, which is a little bit confusing, but this MRC is just based in Launceston and mostly provides settlement services. So there's some local-based organisations, migrant resource centres that are here to provide support for the increasing numbers of new Tasmanians. So please do get in touch with me if there's anything I can assist you with.
Thank you, Ruth. Thank you for the presentation. So now we are with the last presentation of the day. Maggie Greening is with us from the PICAC Western Australia. Maggie is working as a PICAC project consultant at the Fortis Consulting.
Welcome to the far, far west and the deep, deep west. So it's nice to have you here. It's sunny here. It's a beautiful day, as it always is in WA. Moving on to the first slide where we're looking at those top 10 birthplaces. One of the significant things about WA is that we're almost 40% of our population come from core backgrounds. So we've either had one or both parents born overseas. And so that's a big proportion for us to think about in terms of our client base and also our workforce. So you can see the main populations of people are from Italy, India, Myanmar, which is really interesting. But having said that, one of the complexities that presents is language. And so people come, obviously English is a second language. But also one of the benefits of that is that we can then tap into those resources, and that's kind of where we're going to and where we come from in WA. So we've seen lots and lots of resources across the country which PICAC WA taps into, and so we have a specific multicultural resource page with links to all of those resources that are the PICAC Alliance have highlighted today. But in addition to that, WA also has some local resources. So that was one that was presented during COVID, was understanding that we in WA work with providers. So we work with the workforce, providers to help their workforce increase their capability. So that's the main focus of what we try and do. So it was important during COVID to think about how do we provide resources for our local aged care providers, not just called providers, but generally all providers. How do we provide those resources out to, and what do we need to provide? What is it that we don't currently have? So we set about looking at having a toolkit, to help organisations to be able to access something that can help them get through the COVID. There were so many resources out there, but specifically for our called organisations, there wasn't too much. And then the second thing was that it was a hard time for organisations. So it was about thinking about how can we provide a resource to our organisations to look at how they become resilient to get through COVID and continue to be able to provide their service. So a lot of our smaller called organisations obviously were impacted hugely by that. So just creating a resource that we could go out and help organisations to assess and look at their business and help them to consider what they could do differently to be able to survive, really. So we've got those resources. We've also got our own local multicultural resources that staff can use with their clients, but also there's that huge network of resources out there that we link to in terms of the other national resources that are available. And then the thing that I want to talk about is how we do things here in WA, PICAC WA, is to work with organisations to think about how they can utilise those resources we talk about in terms of staff, families, carers, and the language resource that they can bring, but also looking at that's the physical resource. So also looking at their ability to be able to provide advice around cultural norms. Now we can get that stuff online and we can link them online, but this case study I want to talk about today is about how we can utilise, just by developing something as simple as a multicultural charter, how we can utilise helping people to link into the resources that exist internally. So looking at within the organisation, the issue in this particular case study was the communication between staff who were from other non-English speaking backgrounds, which were different to the client's language background and different to carers' language background. And so sometimes there was a conflict and the complexity that brings. So how do we utilise those resources and identify those resources to be able to give that organisation a broader perspective of what's available? And so we took the multicultural charter as a way of doing that, but it also helped the organisation to take ownership of it. So we included family carers, we included clients, and we included workforce and management. And all those people came together and identified what some of the issues were. And language was huge, but also what sat around language was those cultural norms, which people weren't able to find the resources for. So this particular scenario was going outside of your organisation. So this organisation provided services to Italians, Macedonian, but they've also extended out and they had a client from Spanish background and Chinese background. When you've only got one client, but you don't have the resource within your physical resources or your people resources, it was about linking them to other organisations in our community that have that skill and ability to be able to provide that resource. So what I guess I'm trying to say is it's not only linking into your web resources, it's also looking back into your internal organisation and saying, hey, we have people that speak these different languages. We have people in the community that are linked to community that have a wealth of knowledge and experience in a particular culture that we can link to. So, we've got a Chinese organisation here in WA that that are on our PICAC advisory group. We've got another big organisation called Umbrella that have got over 60 different cultures that they work with and deal with. So if you've got that huge resource base, it's how do you access that? And that's what we in PICAC WA can do. So it's about linking people and it's about that networking. So it's linking people to the right resource. And it's also about using those web links and those physical resources, but it's having people from that cultural background that's able to take someone through the aged care process. What are some of the difficulties that they might have? For instance, if you can't access a support group, having someone who can tell you what's required in order for you to attend something is much easier than probably downloading a resource and just giving it to them in their language. So that's kind of the focus that we have here in WA. You can contact us through info@fortisconsulting.com.au and you can give us a call. You can call me or give me an email, send me an email, and we'll be in touch. Thanks for listening.
Thank you very much, Maggie. So again, the collaboration and networking is the answer. So we would like to thank everyone for being available for today's session. And please don't forget to check the culturaldiversity.com.au for the other webinars. Bye for now.